Each week in Medical Rounds, we go in depth with a doctor, a local doctor, to give you some perspective on very important health information. May happens to be Stroke Awareness Month, and it's a good opportunity to learn more about the factors that can contribute to this potentially deadly medical event. Here to talk more about it with us right now is Dr. Mark Alberts, a co-physician-in-chief of Hartford HealthCare's Ayer Neuroscience Institute. Doctor, thank you very much for joining us today.
Thank you for having me.
Let me ask you first, what exactly happens for those who don't know? What can they experience when they suffer a stroke?
Right. When you have a stroke, there's an interruption of blood flow to the brain typically, or there's bleeding in the brain. And then what happens is that you can have the sudden onset of weakness or numbness on one side of your body, the sudden onset of trouble talking or trouble understanding, or the sudden onset of not being able to see, going blind in one eye. Those are all indications that you're having a stroke.
So you just went over some of the signs and symptoms right there, but obviously these are potentially very serious if someone doesn't pay attention, right?
Absolutely. When someone's having a stroke, we say time is brain, because every minute that somebody is having a stroke and it's not treated, you lose about 2 million nerve cells in your brain, 2 million nerve cells a minute.
My goodness. What are some of the treatment options available right now for stroke patients?
Right. Well, we have blood thinners like TPA that can break up a blood clot that could be causing a stroke. And we have new, what we call endovascular devices, devices that actually go within the blood vessels in your brain. They snag the clot and they can remove it. And this can actually reverse the effects of a stroke if the patient comes in for care within a certain time period.
It's interesting because when you talk about some of the symptoms people may have, they could almost be confused at times with some other things, but I'm sure you would encourage people, if you think something's wrong, get medical attention, right?
Absolutely. You want to lie down, make sure you don't fall and hurt yourself, call 911 and get to a stroke center hospital as soon as you can. Fortunately, we have one in Hartford, which is Hartford Hospital. We're one of only 2 comprehensive stroke centers in the entire state.
Well, it is very good information to know. Dr. Alberts, thank you so much for joining us this afternoon. We appreciate it.
Thank you.